Welcome back to Mangevity. I am Simon, and today we are talking about a problem that affects way too many guys, but nobody really talks about it. That is, pelvic floor secret to last longer in bed. If you struggle with this, you're not alone. Studies show that about 1 in 3 men deal with this at some point. It's embarrassing, and it can really mess with your confidence in your relationship. But here's the good news. There's a simple solution that most doctors don't tell you about. It's completely natural, costs nothing, and actually works. We're talking about your pelvic floor muscles. Now, I know what you're thinking. Pelvic floor? Isn't that just for women? Nope. Men have them too, and they're the secret to lasting longer in bed. Today, I'm going to show you exactly what these muscles are, why they matter, and most importantly, how to train them to dramatically improve your stamina and control. Quick disclaimer, this is an educational content based on research. If you have serious concerns, talk to a healthcare provider. If you're new here, hit that subscribe button. We talk about real men's health solutions. Let's dive in. What is your pelvic floor? First, let's talk about what your pelvic floor actually is. Your pelvic floor is a group of muscles at the bottom of your pelvis. Think of them like a hammock or a sling that holds up your bladder, supports your bowels, and plays a huge role in sexual function. Here's the simple way to find these muscles. Next time you're peeing, try to stop the flow midstream. The muscles you just used, that's your pelvic floor. Or imagine you're trying to hold in gas. Those muscles you squeeze, pelvic floor again. These muscles do a lot of important things. Control when you pee, control when you poop, support your organs. And here's the big one. They control ejaculation, how pelvic floor muscles affect sex. When you orgasm and ejaculate, your pelvic floor muscles contract rapidly. They squeeze and push the semen out. This is a reflex. It happens automatically. But here's what most guys don't know. You can actually control these muscles, and when you learn to control them, you can control when you ejaculate. The 2 skills you need. Skill 1, tightening, contracting your pelvic floor. This is like doing a squeeze. You can use this to delay ejaculation when you feel it coming too soon. Skill 2, relaxing your pelvic floor. This is just as important. Many guys who finish too quickly actually have pelvic floor muscles that are too tight. They're clenched and tense all the time, which can trigger early ejaculation. So you need to learn both, how to squeeze when needed and how to relax when needed. Multiple studies have shown that pelvic floor muscle training can help men last longer. One study found that about 40% of men with premature ejaculation who did pelvic floor exercises for 12 weeks saw major improvements. Another study showed that combining pelvic floor exercises with other techniques worked even better, up to 60-80% success rate. The point is, this isn't some trendy gimmick. It's a proven method that addresses the actual muscles that control ejaculation. And the best part? You can do these exercises anywhere, anytime. Nobody can tell you're doing them, and they're completely free. And why your pelvic floor matters for lasting. Let's talk about why pelvic floor training helps you last longer. Problem 1, weak pelvic floor muscles. If your pelvic floor is weak, you don't have good control. When arousal builds and those muscles start to contract for ejaculation, you can't stop it. It's like trying to stop a car with weak brakes. You press the pedal, but nothing happens. Strong pelvic floor muscles give you the ability to put on the brakes when you need to. You can actively contract them to delay ejaculation. Problem 2, overactive tense pelvic floor muscles. On the flip side, some guys have pelvic floor muscles that are chronically tight and tense. They're always partially contracted, like a clenched fist. This tension can actually trigger early ejaculation. Your body is already halfway to the reflex, so it doesn't take much to push it over the edge. If this is you, you need to learn to relax those muscles, not strengthen them more. The exercises, how to do them. Most guys with premature ejaculation actually have the tight pelvic floor problem, but both can be fixed with the right exercises. All right, let's get practical. Here's exactly how to train your pelvic floor. Exercise 1. Regular Kegels for strengthening. Step 1. Find the muscles. Remember, stop peeing midstream or squeeze like you're holding in gas. Those are your pelvic floor muscles. Important, don't tense your abs, thighs, or butt. Isolate just the pelvic floor. Step 2. The squeeze. Contract your pelvic floor muscles. Pull them up and in like you're lifting them inside your body. Hold for 3 to 5 seconds to start, then relax for 3 to 5 seconds. Step 3. Repeat. Do 10 repetitions. That's 1 set. Do 3 sets per day. Morning, afternoon, evening. Step 4. Progress over time. Week 1-2, hold for 3-5 seconds. Week 3-4, hold for 5-7 seconds. Week 5-6, hold for 8-10 seconds. Eventually, you can hold for 10 seconds, relax for 10 seconds, and do 10-15 reps per set. Tips for regular Kegels. Breathe normally while doing them. Don't hold your breath and stay relaxed in the rest of your body. You can do these sitting, standing, or lying down. Nobody can tell you're doing them. Do them while driving, watching TV, at work. Exercise 2. Reverse Kegels for relaxation. This is the exercise most guys have never heard of, but it's just as important, especially if you have a tight pelvic floor. Step 1. Feel the difference. Instead of squeezing and lifting, you're going to gently push down and out. It's like you're starting to pee or starting to pass gas, but you're not actually doing it. You're just engaging those muscles in the opposite direction. Step 2. The gentle push. Push your pelvic floor muscles down and out. You should feel a release of tension like you're letting go. Hold this relaxed, slightly pushed out position for 3 to 5 seconds. Then return to neutral, not tight, not pushed, just relaxed. Step 3. Repeat. Do 10 repetitions. That's 1 set. Do 3 sets per day. Tips for reverse Kegels. This should feel like a release, not a strain. Don't push hard. It's a gentle engagement. Focus on the feeling of letting go and relaxing. Now we move towards exercise 3. Quick flicks for responsiveness. This trains your muscles to respond quickly. Contract your pelvic floor as hard as you can for 1 second, then release completely. Repeat 10 times quickly. Squeeze, release. Do 2-3 sets of these after your regular Kegels. This helps you develop the ability to quickly engage your pelvic floor when you need to during sex. How to use these during sex if you feel ejaculation coming too soon. Option 1. Contract your pelvic floor hard like a regular Kegel hold for 5-10 seconds. This can delay ejaculation by interrupting the reflex. Also called squeeze technique. Option 2. Relax your pelvic floor completely like a reverse Kegel. Let all the tension go. This works especially well if you tend to clench and tense up during sex. Which one works better for you? You'll have to experiment. Most guys find that relaxing, reverse Kegel, works better because the tension is what's triggering early ejaculation. Besides these exercises, there are some other tips to last longer. Pelvic floor training is powerful, but it works even better when combined with these strategies. Tip 1. Control your breathing. Most guys hold their breath or breathe shallow and fast when they're aroused. This builds tension and speeds up ejaculation. Instead, breathe slowly and deeply through your belly. Inhale for 4 counts, exhale for 6 counts. Keep breathing rhythms slow and controlled. This activates your parasympathetic nervous system, the rest and digest system, and helps you stay calm and in control. Tip 2. Relax your whole body. Notice where you hold tension during sex. Common spots, thighs, buttocks, abs, jaw, shoulders. Consciously relax these areas. Tension anywhere in your body contributes to faster ejaculation. Tip 3. Slow down. You don't have to go fast and hard the whole time. Vary your rhythm. Fast for a bit, then slow down. Deep thrusts, then shallow. Pause completely and just hold still when you need to use these pauses to do a reverse Kegel and breathe deeply. Tip 4. Change positions. Some positions are more stimulating than others. Experiment to find which ones give you more control. Generally, positions where she's on top give you more control. You're not doing the work. Side-by-side positions are less intense. Doggy style and missionary can be more intense. Tip 5. Focus on her pleasure first. Take the pressure off yourself. Spend time on foreplay, oral, fingers. Get her close or make her orgasm before penetration. When she's already satisfied, you'll feel way less pressure to perform perfectly. Ironically, this often helps you last longer anyway because you're more relaxed. Tip 6. Use the start-stop technique. We mentioned this earlier, during sex. When you feel close to ejaculation, stop all movement. Pull out if needed, or just hold completely still. Breathe deeply and do a reverse Kegel. Relax your pelvic floor. Wait 30-60 seconds until the urge passes. Resume. Do this as many times as you need. Most partners are totally understanding and supportive when you explain what you're doing. Tip 7. Communicate with your partner. Talk about this. Don't suffer in silence. Most partners want to help and will appreciate that you're working on it. You can even make the training part of your intimate time together. Practice during foreplay or slower, more relaxed sessions. And tip 8. Consider desensitizing products. Optional. There are sprays and creams with mild numbing agents, like lidocaine, that reduce sensitivity. They can help in the short term while you're building pelvic floor strength. Most guys don't need them if they stick with the exercises. Tip 9. Manage stress and anxiety. Performance anxiety makes the problem worse. You get nervous, tense up, and finish even faster. It's a vicious cycle. Ways to reduce anxiety. Practice relaxation techniques daily. Meditation, deep breathing. Exercise regularly. Reduces overall stress. Get enough sleep. Limit alcohol. It might seem like it helps you relax, but it actually makes control worse. Tip 10. Be patient with yourself. Real improvement takes time. Don't expect to be a porn star after 1 week of Kegels. Most guys see noticeable improvements after 4-6 weeks of consistent practice. Some take 8 to 12 weeks, but the benefits are worth it, and they last. Powerful benefits of these exercises. These exercises can offer you the following benefits. Benefit 1. Better awareness. When you train these muscles, you become more aware of them during sex. You can feel when tension is building. This awareness alone helps you control ejaculation better. Benefit 2. Stronger erections. Your pelvic floor muscles help trap blood in the penis during an erection. Stronger muscles mean firmer, harder erections. Benefit 3, more intense orgasms. These muscles contract during orgasm. Stronger muscles mean stronger contractions and more powerful orgasms. Benefit 4, better bladder control. As a bonus, you'll also improve urinary control. No more post-pee dribble or leakage. So you're not just lasting longer, you're improving your overall sexual health and function. This isn't just about lasting longer. It's about having better control, firmer erections, stronger orgasms, and more confidence in bed. And the best part, it costs nothing, takes just 10-15 minutes a day, and actually works. If you found this helpful, smash that like button and subscribe to Mangevity for more real men's health solutions. Drop a comment below if you're going to try this. Public commitment helps you stick with it. And if you want more videos on sexual performance, check out the links on screen. Thanks for watching. Here's to your confidence and your health. I'll see you in the next one.